evening, everyone. So tonight is quite a sensitive subject. We are discussing birth trauma. And I've never covered this topic before. And usually I'm quite jokey on here. It's just my personality. So I hope I can do it justice. Yeah, sometimes I just say the wrong things. So I hope I don't do that tonight because this is a really serious topic. I've discussed it on my stories at length before, and so delighted to have Niamh Healy join me tonight, who is a birth trauma resolution therapist. She's also the president of Cuidiú in Ireland at the moment, and she's a fantastic lady and actually lives quite close to me. So we're representing Northside tonight. See, there I go already. So I'm just going to invite Niamh, and she's at my bump, my birth, my baby. There we go. And that's gone through. So we'll just wait for Niamh to join us. Hi, Niamh.
Hi. It looks like I thought. Okay, there we go. All right. You were seeing the mess that is my office.
Now we know, Niamh. Now we know.
Yeah. How are you doing, Aoife?
I'm doing great. How are you?
Good.
I was just doing a little introduction, Niamh, because when these go out, there's always the beginning part that no one speaks at. And so I was just introducing you to everyone that you're currently the president of Cuidiú in Ireland, which is nothing to do with this talk. But you're also a birth trauma resolution therapist. And tonight we're really having a very serious chat about something that's not talked about enough, Niamh, and you're going to guide it. And I'm going to ask you the odd question.
Okay, great. Okay, well, thanks. And thanks for the opportunity to help raise awareness about it, because as you say, there isn't much understanding of it, and it is such a serious issue. And I think so many people who suffer from birth trauma don't know where to go to get help, or think that they just need to get a grip of themselves and just get over it, whereas it's actually a very normal reaction to experiencing a traumatic event. And I suppose I'd start with saying that whilst we call it birth trauma, trauma can occur, depending on circumstances, can occur at any stage of the parenting journey. So it could be around fertility or trying to conceive type issues. It could be early pregnancy, miscarriage, stillbirth, obviously would be very serious, or any event in the pregnancy journey or the parenthood journey. So birth included, and then early postnatal life. Because it isn't just about how it looks clinically in terms of the birth, the summary of the birth story. In fact, actually, what might be news to some of your listeners, that a birth doesn't have to be complicated to be traumatic, and likewise, a complicated birth doesn't have to be traumatic. So it really depends on how the person feels. So, for example, there will be people whose birth plan, their birth didn't go to plan at all. They ended up with all sorts of interventions that they didn't want. But if they felt involved in the decision making at every step along the way, and if they felt respected and heard and supported at every step along the way, it's likely that they won't be traumatized. Whereas somebody else could have what looks like on paper a fairly straightforward experience, but if they had periods of time, especially long periods of time, where they felt either dismissed, disrespected, not listened to, perhaps procedures done without consent, that might end up being more traumatizing than the clinically more complicated picture of the other person's experience. So I think that's important to say.
Yeah, and even when it comes to birth trauma, as it's called, even a straightforward labour is traumatic. Like, how many times in our life do we experience, be it miscarriage or deliveries or stillbirths? Like, it's really an event that may only happen for some of us 1, 2, or 3 times, and each one is so different, and we don't know what to expect, and it's traumatic. And I feel like, Niamh, women never get a chance to talk about labour. Like, when they're pregnant, there's all this talk about it and holding their hands, and then labour is over and it's just baby, and I'm not just even saying discharge. They just didn't even get a chance to kind of go through everything that happened, even if it was normal, quote unquote, because it is a traumatic experience. Our nervous system reaction, our adrenaline, the come down after it, and then trying to figure out what's gone on, it's traumatic for everyone.
Absolutely, absolutely. Although I think, you know, being very well supported in labour can at least make that an easier process. Um, yeah, and I think that whole business of just getting on with it, just being responsible for a tiny human being straight away, is a huge transition for anybody, but especially somebody who has experienced the birth as traumatic. And I'll just explain why these events can cause lasting symptoms of trauma. And it's because normally when the brain lays down lays down memories, it lays them down with the story, so what happened, but also with lots of context. But if a person is in a situation where their stress hormones are at an elevated level for a long period of time, plus, you know, in birth there would be all sorts of hormonal things going on as well. But if their stress levels are very high for a long period of time, then the brain isn't able to process the event and store it with that context. And then because the brain is very good at pattern matching, an example of that would be, you know, a positive example would be how you can be brought right back to childhood by a song or a smell or perhaps a sight. But in the for the traumatized person, their brain might pattern match to something predictable like a birth program on TV, or seeing the, you know, having to pass by their maternity hospital. But equally, their brain could be triggered by something that isn't obvious at a conscious level, like the tone of voice of somebody similar to somebody who was involved in their care, or a color of hair, or, you know, the color of Scrubs clothing. That sort of thing can sometimes trigger people. So sometimes people can end up with flashbacks or panic attacks seemingly out of the blue, but it's not out of the blue for the subconscious brain, which is able to do all this pattern matching. And they would be some of the main and most obvious symptoms of trauma: intrusive thoughts or memories, where the person's mind just keeps going back over and over and over. It's almost like the event has got a hold of their mind. Or then the more dramatic flashbacks or panic attacks. But also things like hypervigilance as well can be a symptom of trauma. So luckily, about 80% of people can process trauma within, say, 4 to 6 weeks, and often, you know, being well supported and having their story validated can help with that. But about 20% of people end up with lasting symptoms of trauma, or they may even have full-blown PTSD. And that's where the likes of birth trauma resolution therapy comes in. And you know, it's a very fast and solution-focused therapy that's designed to mimic the natural action of the brain, where the brain is able to take the memory, contextualize it, and put it into the right part of the brain where it is past tense. It's not about sugarcoating it. It's not about saying what happened is okay. It's about saying it's past. Whereas if it was left in the amygdala, it's left with all the present tense emotions, and that's why the panic attacks are so intense, because they're bringing up the same visceral emotions and sort of psychological states as were present during the event.
Yeah, wow. And Niamh, as someone, I suppose, who didn't experience birth trauma per se, but I remember the exact words the midwife said when I had my first baby. Like, I can remember things that I couldn't remember what someone told me last week that was really important, or a birthday date, you know?
Yes.
Absolutely. I think so many of us remember a song, a smell, the words that were used. And I know the healthcare workers that are there, you know, that's their job. Like, for a lot of the time, they're just saying things. They're not, you know, when it's their livelihood and it's all day. It could be like, I could say the wrong thing to a patient in work by accident, not realizing. But it's just, as a patient, when you're on the other side of it, you remember everything they say. And if it's one negative thing, like it sticks in your brain, or something I did wrong, or why did they do that? Like, it, you know, and again, is it really them? Is it a mix? Is it just that our body has gone through such a trauma, and, as you say, our brain is contextualizing that? Or is it a mix of, you know, perhaps what they did say too?
Yeah, probably a mix, definitely. And I think there's a bit more awareness now about trauma-informed care, where healthcare professionals are learning more and more about how to pay attention to every word and every gesture, you know, because of course faces can say a lot as well, and sometimes in emergency situations people can sometimes remember just the look on a midwife's face. But you know, we'd love if our maternity services were so well staffed that every midwife felt that she was able to fully support emotionally and psychologically every woman or birthing person that she was dealing with, and to really cherish her and to pay attention to everything. But I think, yeah, with the current staffing levels and the just the throughput through the hospitals, it's unlikely that it's going to be perfect every time. But about half of the people that I've worked with experienced a genuine clinical emergency, but the other half of people that I've helped to get over their trauma, it has been more about how they were treated. Okay. And you know, an example was somebody who was really, really hoping for a natural birth, ended up with a complicated enough birth and an emergency cesarean, and she's happy enough with all that because she was involved in the decision making and she felt well supported. But there was a midwife who was unkind to her in the recovery room, and that's where her mind kept going back to over and over and over again. You know, and we might excuse that by saying that at the time it was right in the start of COVID, everybody was under pressure, everybody was frightened. So, you know, you can come up with reasons for it, but yet we still shouldn't excuse that either. And there's just so many stories like that.
Yeah, and look, we all know the staffing levels are hard. We know that it's hard for everyone to be on top form all the time. But what we've got to do is acknowledge how the woman feels and help her get through it. And to my knowledge, again, like this postnatal services in the maternity hospitals across Ireland, it's hard for women to even seek counselling or support. I know they do, for people watching who don't know, they do a birth reflection service, and there's midwives who are highly trained to go back through your notes and discuss everything with you. But I do know that there's not always counselling services available, and women need, we were talking about this a few weeks ago in Pregnancy Loss Awareness Month or Week, and we were talking about miscarriages, and if it's before the 20 weeks and not considered a stillbirth, how there's absolutely no support after that. Like, it's all a medical treatment, and once the miscarriage has happened, the woman is just out on her own with absolutely no emotional, psychological, medical support, just dealing with that as a big trauma to her, you know, with a very sad ending.
Yeah, absolutely, absolutely. And there's a couple of things there, you know. People sometimes have the choice of a clinical debrief after a very complicated birth, or the birth reflection services. And I think it's important to know that the birth reflection service is typically done in a more sensitive manner. A clinical birth debrief tends to be one-way traffic. It tends to be simply information coming from the doctor or the midwife explaining what happened, and it never, they typically don't invite information back to ask how the woman felt at the time, whereas the birth reflection service is done more sensitively, and there is a bit more of a dialogue and a bit more of the you know, inquiring as to her lived experience of it and validating her story, as well as explaining, because sometimes people can be quite confused as to what happened or why they needed a particular intervention. But yes, in terms of counselling, you know, counselling, of course, after something like miscarriage is always going to be very helpful. If the person has experienced trauma and is experiencing lasting symptoms of trauma, sometimes constantly going over and over the story can be re-traumatizing. So counselling per se is not always helpful in trauma. Sometimes it is, but not always.
Off on my phone. I'm so sorry. Jay-Z was playing in the background. That was just the most inappropriate thing. I'm so sorry to everybody.
No,
sorry, we're good.
You're fine. Yeah. 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 And my business name is My Birth, My Bump, My Birth, My Baby, and my colleague Mim and myself are both trained in birth trauma resolution. therapy, but there's also a number of other practitioners around Ireland. So Mim and I are based in Dublin, but the other practitioners are dotted around Ireland, and you can find their details on birthtraumaireland.ie. So it's a new website. Our SEO isn't very great, it doesn't come up on Google, but birthtraumaireland.ie. And actually, in saying that, none of us are particularly good at social media. So it's great to be invited on to lives like this to help to raise awareness and to spread the word.
Yeah, and look, I didn't know, and believe it or not, that's why I'm on social media and I don't really do ads or anything like that. It's just about educating women, and that's brilliant. I did not know that that site existed. I will absolutely post it. I hope loads of my fellow women's health physios and obstetricians out there do share it too. And just to say, Niamh, like, I'm never having a go, and I don't want it to seem like I'm be negative about the maternity care in Ireland. I think like that, like the outcomes of patients and litigation now when it comes to maternity care, like the outcomes, I think every woman, whether it's a C-section or vaginal delivery, there's always changes to our body, but it's the experience. And like you said, like every woman experiences it differently, and they need a chance to reflect on it and to seek help if they need it, and know that the help is out there, and it's not just, oh, this is normal, we all go through it. And like, as you said, our nervous system response and the hormones postnatally, and some women struggling with postnatal depression and other intrusive thoughts, like this is really important that we raise awareness. And can I ask you, do you also, I'm assuming, deal with women who've had miscarriages at any stage of their pregnancy? Do you also deal with that? Brilliant.
Yeah, absolutely. Well, what we would do is we would use a screening form to screen for trauma, because it's trauma specifically that we're treating. And so we have a screening form, and that's actually something that's a valid point as well. Very often GPs are only looking at the Edinburgh scale for postnatal depression and postnatal mood disorders, whereas trauma has different symptoms, but there is a little bit of an overlap. So it can sometimes look like somebody experiencing trauma, actually they might end up being misdiagnosed as having postnatal depression, and treatment for postnatal depression, which is typically counselling and or medication, won't sort the trauma. So the medication might temporarily alleviate some symptoms, but it won't actually take the trauma away. So that's why something like our therapy is then required to help shift the memory in the brain from the amygdala into the hippocampus, so that it can become a past tense memory, no longer attached to those visceral emotions. And then we have other techniques as well about rebuilding, because sometimes suffering from trauma can really put a dent in a person's personality, and that they just don't feel like themselves as much as before. They don't feel as outgoing, maybe they don't feel as confident, they might not feel as social. So, we can work on rebuilding techniques, and a lot of people do say after the treatment that they just feel more like themselves.
Wow. And needless to say, if it's been a miscarriage, it's mixed with grief. It's mixed with the feeling like this life we planned has changed, or what did I do wrong? And they might not even realize there's trauma to the actual miscarriage itself, and the care they received, or why it has happened. And, and then when it comes to postpartum like that, you could misconceive it for postnatal depression or hormones, or just struggling with the anxiety of motherhood. So it's such a difficult time for women that it's hard for them to even maybe realize this is birth trauma, because
Absolutely.
It's a different case if you had a car accident and you're like, I had an accident and then I felt like this, and it's very straightforward. But when it comes to pregnancy loss or delivering a baby, there's so many other things going on. It just might not even be clear to them that this is the thing they need to focus on.
Absolutely. And on that website, birthtraumaireland.ie, we have put up the screening form, so people can have a look themselves and see themselves, am I ticking a lot of these boxes here? And that might actually really help them to realize what's going on. And Mim and myself made a video. It's on our YouTube channel, and in that video as well, we have the analogy of somebody really looking forward to going to Disney World with their family, being really excited, saving up for years, planning the trip to Florida, just can't wait. And they go to the airport and they all excited, kids are all excited, and they get on the plane. And halfway across the Atlantic, the plane is hijacked and they're held at gunpoint for several hours, not knowing if they're going to live or die. But thankfully, rescued by a SWAT team, able to continue their journey to Florida. Does society in general expect them to have a good holiday and engage in the whole Disneyland or Disney World experience and go to all the parks? But yet, no matter what has happened to somebody, whether it was this birth that just happened or perhaps other miscarriages, recurrent miscarriages, anything like that, it passed in their lives, that they're all of a sudden expected to be delighted and embrace new parenthood, no matter what their journey to parenthood has been like.
Yeah,
So,
and yeah, that's a brilliant analogy. And again, when they're visited by family or friends post-birth, they don't open up and tell them all about the labour. It's a really quick story, or maybe they ignore it altogether and they kind of have to put on this smiley face. It is why when people come to me for a postnatal check, the first thing I do is ask them all about their labour and let them talk as much as possible. And I have a box of tissues because a lot of people start crying. But even when my friends have babies, the first thing I go in when I'm seeing their baby is like, tell me about your labour, like in detail. I don't mind if they go from the first contraction, I'm just like, they never get to talk about it, even to their husband. Like, it's just all over and there's a baby and you're like, hello, what did I just go through? So again, for those of you who not even sure if it was a trauma, it is a sense of trauma to all of us, but it's different how our brain deals with it afterwards. And we all have such different stories, but we all are entitled to talk about it or feel like we need help, whether it seems on paper like it went well or not.
Yeah, and validation, I think, is very important. So it doesn't matter if somebody looks like they had a straightforward birth experience, if they are given the opportunity to express how they felt at different stages, and somebody else is validating that and telling them they're entirely entitled to feel that way. That will be very helpful to them, rather than saying, oh, for God's sake, sure, she had it much worse. Or haven't you got the healthy baby? Snap out of it, get a grip of yourself. Validation is very important. So it's great to hear that you do that.
And you know what? That's something my mum would say, to be honest. You've got to be careful who you surround yourself with. Like, even the people closest in your life, it can just be their personalities where they're like, book on, get on with it, you'll be fine. We've all done it before. So in that sensitive time, you've really got to be careful who's around you. The right people are around you. To hear you or not hear you, or not ask you or ask you, And can I ask, Niamh, I'm assuming this is a private service, and do women, they could, let's say there was no one in their county, could they access you via Zoom? I know it might be nicer to be in person, but there might not be people all around the country.
Absolutely. So yes, we'd always recommend in person if it's possible, but a couple of the practitioners, Maria Saunders based in Naas and Barbara Brooke in Galway, can do online therapy. So that's great. And some of us then will be able to do that in another couple of years when we have more experience. But I think in person, if at all possible, is the best.
And hopefully, Niamh, the more we raise awareness about these things, the more women will reach out for these services to help them. And then hopefully there'll be more therapists out there that train in it because they see the real need. And dare I say, imagine if the HSE employed some. Wouldn't that just be amazing?
There are some midwives in the Rotunda trained in birth trauma resolution. I trained with them. So the training course that we did was accredited by the Royal College of Midwives in the UK, and everybody on our website, the private practitioners on birthtraumaireland.ie, we all trained on the same accredited course. So that was with Jenny Mullen in the UK, and there was 6 months training and 6 months supervision, so a very comprehensive course.
Okay, wow, brilliant. And look, hopefully those midwives in the Rotunda can actually set up a service. Like, I'm sure they'd love to. It's just their services might be needed somewhere else. I know the midwives who do birth reflection have, some of them have gone and done psychology and other, definitely other training. 2 in Cork training at the moment. Thanks very much. So yeah, the more, if they can bring it back to their hospitals, please God, and set up a pathway and referral for patients that people can access this, would be amazing. Niamh, thanks so much. I'm so glad we got to talk about this topic. You know, I'm definitely going to share the website and just get this across to people. I know social media is not for everyone, but it's the way we reach women, because women even still say, I don't hear about this. I didn't know about this. And
Yeah.
even if we could get into the maternity services, or GPs hear this and the GPs know to refer women, that there is a service out there.
Absolutely. And we don't have much on our grid on My Bump, My Birth, My Baby, but my colleague Mim is a dab hand at Canva, and she did up a series of infographics around birth trauma. So people will find it there, as well as that 15-minute video on our YouTube channel that explains to parents all about birth trauma and then birth trauma resolution therapy. And I think what's useful to note as well is it's not just women or birthing people who can experience the trauma. Partners can as well, or anybody who witnessed a birth. And of course, that also means that some midwives are going to end up traumatized over the course of their years of practice. So, you know, we have treated fathers as well, because you can imagine that there can be situations where all the focus is on the mother, but there's a lot of concern in the room, a real emergency situation that he or she could be witnessing their partner in what they think is a life-threatening situation, and they are powerless to help, and they want to help. They felt that that was going to be their role, to advocate for her, to protect her, and all of a sudden they are completely powerless and helpless, and that can have a lasting effect on partners.
That is, yeah, that is totally fair enough. Wow, that is, do you know what I'm going to do, Niamh, when we come off this? I'm going to share the link to that YouTube video as well, because that'll give people even more information, and we just need to keep sharing and sharing, and you keep doing what you do, Niamh, helping women, be it in breastfeeding support or birth trauma resolution. You're amazing. So, you know, keep doing what you're doing. Thanks so much.
Okay, all right. Okay, thanks very much, Aoife. Bye now.
Bye, Niamh. Bye.